All right, everybody, welcome to the session. My name is Micheline Hynes. I work for Tarrant Area Food Bank. And the first thing I want to do is make sure everybody knows that this session is being recorded. If your video is on, you may be recorded. So if that is not something you're comfortable with, now would be the time to turn off your video. We're also asking that people leave themselves muted during the duration of the webinar. And I'm so happy to introduce our webinar today in celebration of Hunger Action Week. We are going to be talking about plant-based diets and the need for nutrition in clinical settings. There's a few facts that I want to share with everybody. First off, to put this in context for you, in our service area with Tarrant Area Food Bank, we serve 13 counties here in North Texas. And in those 13 counties, 1 in 6 people are hungry, or sometimes that's also called food insecure. 1 in 4 children are considered food insecure or hungry. That means that Texas is the 2nd highest in childhood hunger in the country, and Tarrant County is in the top 10. I think we're actually somewhere around 5th in the United States for the counties that experience food insecurity. So we are one of the highest counties in the country with food insecurity. And there's 2 really important things to note about that. One is those are pre-COVID numbers, and we have seen the need for food go up dramatically since COVID started. In fact, last year we distributed a little over 40 million pounds of food to these 13 counties. This year, as our year closes at the end of this month, we will have distributed 60 million pounds of food. It's a very great thing. We recently upgraded our distribution center to be able to move much more food than we had the capacity to do before, but the need is higher than ever. And what these numbers tell me too, if that many people are food insecure, then it's not necessarily the people that we think are hungry. Usually when we ask that question in a training or a session, people will, the first population off the bat is the homeless. And while the homeless often experience hunger, there's only population that does. So a lot more of our friends and neighbors are hungry than we might think. So I'm very pleased at this point to be able of our speakers. We have Dr. Teresa Wagner. She is an assistant professor in Lifestyle Health Science Department at the Health Science Center here. She's also the clinical executive for health literacy at Safer Care Texas. We also have Dr. Cynthia Ambres. She's the Chief Medical Officer for Kate Farms, and she'll be speaking a little bit later in the presentation. So now I am going to turn this over to Dr. Wagner.
Thanks, Micheline. I'm going to share my screen really quick. And so today I'm going to be talking to you about plant-based diets. And if you read the description for this session, you'll know that when we talk about plant-based diets, that doesn't mean that we necessarily exclude all animal foods, although there are some cases where people might do that. But we just encourage that we focus on more plant-based foods in the diet overall to increase health and wellness. So one of the factors that I really wanted to talk about is the fact that in lifestyle medicine, which is one of the things that I'm certified in, and really where this plant-based diet is emphasized quite extensively, there are other pieces to the puzzle when we talk about overall health and wellness. And so I just wanted to run through those quickly, but it's regular physical activity, a diet rich in plants, connectedness. So making sure that you have socially and intellectually stimulating activities that helps with mental health and keeping us vital and connected to our community. And then also quality sleep. I think people don't really realize the role that sleep plays in overall health and wellness. Mitigating stress, so making sure that you take little stress breaks, especially now that we're working almost 24/7 online. And preventing or stopping use of substances and smoking. So let's jump right in. When we talk about healthy diet patterns and plant-based diets, we know that a healthy diet helps us to have a healthy body overall. So I'm going to go over 3 plant-based diet patterns with you. So that's going to include the DASH diet, the Mediterranean diet, lifestyle medicine, and then I'm going to go through some of the caveats that we see with all three diets. So supplementation, people often ask about that. Alcohol is another big topic, especially for people who are trying to be super healthy and athletes. And then we're going to talk about myths and tips and give you some resources to use if your goal is to follow a plant-based diet. So let's start with DASH. So the DASH diet has been proven to reduce blood pressure, LDL or bad cholesterol, and also aid in weight loss. It requires no special foods. Instead, it kind of provides a daily and weekly nutritional goal. So you're not eating certain things on certain days. You're just looking at that bigger picture of your overall diet. And it recommends eating vegetables, fruits, and whole grains, which means you can include fat-free or low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils on this diet. But you want to limit foods that are high in saturated fat, such as fatty meats, full-fat dairy products, and tropical oils, such as coconut and palm. And then you also want to limit sugar-sweetened beverages and sweets. And so one thing that we typically see with people who are vegetarian is that they still tend to eat a lot of sugar. So the goal would be really increasing those vegetables and fruits and whole grains in your diet to give you the carbohydrate, and then minimizing those simple sugars. And we'll talk more about that. So the Mediterranean diet is the best and most extensive, has the best and most extensive evidence for overall health benefits. It's been shown to improve longevity, prevents many chronic diseases and cancer, reduces inflammation, and improves mood, fertility, and cognitive function. One thing I really like about the Mediterranean diet, and not that lifestyle medicine didn't emphasize this as well, but it also emphasizes that connectedness. Meals should be shared with friends or family when possible, and then they also talk about physical activity, which I like. So also here, the meals should be based on vegetables, fruits and grains, legumes, healthy oils, nuts and seeds, herbs and spices. Now this diet also does still allow some animal foods such as fish or seafood, poultry, dairy, eggs eaten moderately, wine in moderation, and drinking water, plenty of water. Many of us don't get enough water in our life, especially with all the variety of sugar-sweetened beverages and alcoholic beverages and other things that are out there on the market. So again, it minimizes sweets, but then also in this particular diet, minimizes other meats besides the fish and poultry. So lifestyle medicine is really more swayed towards the vegetarian lifestyle. It really maximizes the intake of whole plant foods and minimizes the intake of processed and animal-derived foods. So it eliminates processed foods, added sugars, oils, refined flour. So it's much more strict, you can see. And then also it eliminates animal products for the most part, including meat, poultry, fish and seafood, dairy, and eggs, although it does allow salmon and other omega-3 fatty acid rich fish, which we'll look at in a little bit. But in common conversation, it's most likely to be what's called a low-fat vegan diet compared to the DASH diet or the Mediterranean diet. And if you are going to get that strict with your diet, it's probably recommended that you meet with a registered dietitian who's trained in lifestyle medicine. And if you are just looking to get a healthier diet overall and follow some of these plant-based food recommendations, maybe a lifestyle medicine health coach. So the consensus among these diets, because now you're like, well, which one should I follow? Well, really, it's up to you. It's a personal preference. But the consensus is that you want to eat plenty of fresh fruit and non-starchy vegetables every day. Focus on plant foods to increase fiber, vitamins, and minerals, because we know that those components of food really help to increase our health. They help digestive function, antioxidants in terms of aging and other chronic diseases that we might have as a result of aging, and other lifestyle habits. So just overall, adding more vegetables into your daily diet. If you just, you're like, okay, I want to get started on this road, what do I need to do? Focus on the green leafy vegetables, including fruits, especially berries, nuts, beans, and whole grains, lean meats, fish, and poultry, again, depending on how far you want to go towards the lifestyle medicine end of the spectrum, and focus on plant-based proteins and fish. And so I'm going to give you some examples of those in just a minute as well. And then choose healthy fats such as vegetable oil, nuts, and avocado. The other consensus among all the diets presented is that you should avoid processed foods and deep fried foods. We know that these foods are very low in nutritional value, but at the same time high in calories, sodium, and fats such as saturated fats. And then also limit or cut out the sugar sweetened beverages, because that's pretty much straight sugar. So what about supplements? I get this question a lot. Well, what we do know is that dietary supplements and nutraceuticals are made for people with nutritional deficiencies. So unless you have a diagnosed nutritional deficiency, you probably don't need to be taking a supplement. So you would need to check with your physician or your registered dietitian. So it should be only used under the supervision of a provider. There's little or no regulation of supplements. So you could be taking something that actually could harm you rather than help you. They often make false claims. They're not recognized as drugs by the definition of the FDA, so that means that they're not regulated. They may be potentially dangerous, as I mentioned. They can interact with other medications. So if you're on blood pressure medication, cholesterol medication, diabetes medications, things that adults are typically on, then you need to be very careful. May disrupt your natural body function. So the last thing you want to do is be taking something that's hampering you from health when you're trying to be healthy. And they may cite research, but they're not held to the same FDA standards. So what about alcohol? That's another question I'm often asked. So a glass or two of red wine is thought to actually have health benefits, but that doesn't mean that we want you to start drinking if you don't already drink. Excess alcohol can actually have negative consequences, and we know that as a general rule, I think, but it slows or impairs brain cell communication, which means it can impair our functioning. Can give us fuzzy memory or drowsiness, which we definitely don't want to have while we're driving. Long-term changes in terms of balance, memory, emotions, coordination, or body temperature. So there are long-term detriments of heavy alcohol intake. Contributes to falls and fall-related injuries, especially in the elderly. It can interact negatively again with many of your medications, and can have life-threatening consequences. So how much is just moderation? Well, interestingly, that's 1 drink per day for women and 2 drinks per day for men. So think about, do I limit my drinking to that much? And just because we say 1 drink per day or 2 drinks per day doesn't mean you can save them all up and have 7 to 14 on the weekend. You really need to stick with the moderation from day to day. So if you look at the serving sizes for beer or a malt beverage, it's 12 ounces. For liquor, it's 1.5 ounces in a drink. For wine coolers, about 12 ounces because they're diluted with other beverages. And then for wine, it's 5 ounces. And when you typically go to a restaurant, they say, do you want the small pour or the large pour? Well, that's the small pour. So here's some easy to use little tools that I like for when people ask me, I'm walking down this hallway at school or what have you, and they say, what can I do to change my diet, or how can I, and I recommend these little tools because they're super easy to just kind of start changing your thinking about eating. So to go more towards the plant-based slant, I would definitely use the Harvard plate and the You can just Google that to find that online. I have it linked to the presentation, which I'm not really sure if that's going to be uploaded or where you might be able to access that later, but we will certainly make that available. And then another one that I really like is choosemyplate.gov, and I like it because it's simple to use. So if someone is not super well versed on plant-based foods or doesn't have a lot of access to information that's more detailed, it gives them a good idea of, oh, there actually is balance in what we eat, and instead of a Big Mac and fries or a big hamburger and fries or other fast foods, I could actually have a planned meal that would include all of these particular foods that are actually in the food groups that I should be eating. So protein, grains, fruits, vegetables, dairy, milk, other plant-based beverages that you might want to use if you don't use dairy or milk. So there are some myths surrounding plant-based diets, and the first one I'd like to address is that there's a myth that you have to consume milk or dairy to meet your calcium needs. But the fact is there are many non-dairy sources of calcium. So all of these myths and facts that I'm going over are available on lifestylemedicine.org as handouts. So feel free to obtain these, because you probably aren't going to be able to write these down as fast as I'm going to go through them. But just want to make you aware that there are plant-based sources of calcium. The second myth is that carbohydrates are bad for you. And so I mentioned earlier about eating complex carbohydrates instead of, sugar and sweets if you are going more towards a plant-based diet. And I think sometimes people try to minimize their carbohydrates too much, and they end up craving those sweets and those sodas because they are too low on carbohydrates. So the important thing to remember is that not all carbs are created equal. And so you do want to include vegetables, fruits, and whole grains, beans, and legumes. They provide energy and essential nutrients that are health promoting. And we do need those in our diet. And we want to aim for about 25 grams of fiber each day, which these actually provide. So we do know also that a healthy diet leads to a healthy brain. And with the onset of dementia and Alzheimer's becoming more prevalent in the US, and because we have an aging population, plant-based foods, especially fruits and vegetables, which I just was emphasizing as knowing that we need to include these carbohydrates, contain these important vitamins and minerals that we need to help preserve cognitive function and to prevent Alzheimer's disease. So preventable harm that we could abate just through our diet. Another myth is that most people don't get enough protein, so people worry about taking meat or animal-based foods out of their diet, but that's not true. The average person actually consumes too much protein. So the average person in the US consumes about 80 grams of protein per day. And if you see in the graphic, men need about 56 grams and women about 46 grams. And that's based on the age range from 19 to 51 and more years old. So that adult age range, but your protein needs do change as you age and when you're younger. So again, a registered dietitian would be a good source to find out what your exact protein needs are. What type of fish? We mentioned this earlier, fish that contain omega-3 fatty acids, so sardines, anchovies, salmon, trout, and oysters. And then not good sources would be tilapia, catfish, orange roughy, cod, and shrimp. So that's why the lifestyle medicine diet recommends more so the salmon. And the last myth is that you need to eat animal protein to meet your protein needs, and that is also untrue. Plenty of protein can be obtained through plant foods, and you can see here where many of those foods are, that things like lentils and beans that I mentioned before in the protein category, and then, comparatively ounce per ounce with meat. They rank pretty high up there in terms of grams of protein. So the other thing you can do is combine plant-based proteins to raise up that level of grams that are available. So there's rice and black beans, hummus and bread, corn and black-eyed peas, bulgur and whole wheat, tofu and rice, corn and lima beans, tortillas with refried beans, and pea soup with bread. Other ways to get vegetarian meals that would typically contain meat, if you're wanting to go more plant-based, is add vegetables and take out the meat to things like pasta primavera, pasta with marinara, all of these things that we typically would add meat to, but you can add vegetables, beans, lentils, etc. So here's some tips and another plate-based graphic that you can use. Again, these are available on lifestylemedicine.org, and it just planning ahead, making sure these foods are available, setting your goals each week, have a game plan for eating. Every day I know pretty much what I'm going to have for breakfast, lunch, and dinner. So it's really good to plan ahead so that you don't get into a position where you don't have those foods available, or you end up not following what you had planned. So I guess my summary is that food is medicine. Your prescription is waiting in your kitchen. And I think that when we use food as medicine, we can actually get ourselves off of medication type of prescriptions and live a much healthier life. Here are my resources. Again, I would highly recommend getting that Harvard Healthy Eating Plate and the Lifestyle Medicine website for your resources. Thank you.
Thank you, Teresa. You know, here at the Food Bank, we deal with a lot of myths around hunger and food and health as well. And one of the things that the research recently has shown is that people who are food insecure often have to make trade-offs between medicine, medical care, and their food. And so what we find is that they are looking for cheaper foods, and which are often the less healthy foods. So Dr. Wagner, can you share just a couple of tips on what are some great affordable sources of food for the plant-based lifestyle? What's a great budget plan?
Well, that's the great thing actually about plant-based eating is, you know, people don't typically think of it, but if you look in the grocery store, beans, legumes, those foods are very inexpensive. It's a matter of cooking them and knowing how to cook them. But again, you can find recipes online all over the place. I'm sure that you guys give out recipes from time to time. And, you know, there's always some great recipes available from things like your extension agent, community health workers. So look to those resources, but also the great thing about fruits, vegetables, beans, legumes is you can extend them over time. So if you don't use them the first time, just carry them over to another meal. Just store them properly to make sure that they stay safe. And lastly, I would say to shop the sales, because use the foods that are in season and look for your grocery flyers, which I guess now may be online these days, but finding out those foods that are on special because they happen to be in season, and then just changing your foods that you're using as the seasons change.
Thank you so much. Again, I just want to remind everybody, if you have questions, to type them in the chat. There was one question about some resources for getting started, and I think that Dr. Wagner happened to immediately share several great resources. I saw there was a 6-week starter plan on there that looked really, really promising too. That's what most people that we talk to want. They like, just tell me what to eat to get started, and then from there they can usually figure it out. But it's nice to have that kind of that leg up on getting started. So I'm going to introduce Dr. Ambres now, and she is going to talk a little bit more about how we can do a better job of nourishing people in clinical and other healthcare settings. So Dr. Ambres with Kate Farms, she's their Chief Medical Officer. And Dr. Ambres, let's just have a little chat about what your thoughts are.
Well, that's wonderful. Thank you, Micheline. And I just want to say, Teresa, that was fabulous. It
Okay.
was such a great overview for everyone, clinicians and persons, that are interested in nutrition. And I just loved it. I am not a fellow as you are, but I am a member of ACLM as well, and really love what the College of Lifestyle Medicine is trying to do to get the word out. So they are also in my resource list as well for people. So it's so important, it's just for all of us to be, just driving this message. So happy to be here to talk about it today.
Thank you. So let's get started with just a little definition of what you feel like the problems are. So what do you feel like are the reasons, that we're making some mistakes in healthcare? What's wrong with how we handle nutrition right now in hospital settings, and what can we do about it?
Well, and when we were talking, Micheline, I think you said, let's throw in sort of the clinic setting as well, because it's all about a ecosystem that's going to include nutrition throughout, because again, what Teresa was saying, that food is medicine, and your medicine cabinet is in your kitchen. I just love it. Your prescription's in your kitchen. And so if we can start there, we need to start informing ourselves as clinicians, and we need to start informing the public about these things. And we're not really doing that as clinicians to the level that we should be. Of course, as a registered dietitian, and with the background that Teresa has, she's doing that. And when we can engage RDs in our clinical practices, they do it. But very often it's sometimes an afterthought, the referral's not done, maybe it's not paid for by the insurance, whatever it is. Our patients don't get to really talk to the dietitian, and in hospital, they're seen as the menu bringers, instead of the information bringers. So, what can we do about that? And I think it's just lack of the conscious awareness of what our part is in it. So we definitely have to learn more. Still today, only 25% of medical schools teach a nutrition course. Crazy. Doesn't make any sense. So we as doctors, we get out. I know I didn't have really nutrition. I went to Mount Sinai School of Medicine, big center in New York City, and very tertiary kind of care, and didn't come out with that basic knowledge of nutrition, and really didn't achieve much knowledge of it until I was at Beth Israel Medical Center, where I was chair of emergency medicine. But a lot of my patients were from Chinatown, because we juxtaposed with Chinatown. And of course, the Chinese American patients are much more likely to be part of what we can focus on with nutrition, and they are focused on nutrition first. So in fact, we would always say when they come into the emergency department, oh my goodness, we know that they've already tried all of the important things that can build their systems. If they're really sick, we're like the last bastion of care. And to some degree, that's the way we should be approaching this across the board, right? So there shouldn't be this idea that nutrition is going to be, sort of a secondary thought for us. So that's very important. We know that 70% of Americans are overweight or obese, according to the latest report from USDA. So that's, extraordinary. So we need to be looking at nutrition, conscious of nutrition, talking about it every day, and how we are, not eating in the hospital system. So you come in, let's say you're acutely ill. Very often in the ICU, we'd see patients on glucose and normal saline for like a week. So I don't know how that's supposed to promote healthy recovery and figure out where we're going to go with them. So we know that there are big holes in the way we do nutrition, and a lot of work that we can do there. Also, we know that the 30-day readmission rate in malnourished patients is 1.6 times higher. So that's extraordinary. And when readmitted, they are 2 times as likely to have a serious infection. So, cost of healthcare, we're going to talk about later, but, these are major things.
So Dr. Ambres, let me ask you a follow-up question. What do you see are some of the maybe systematic things that we can do to incorporate nutrition back in hospitals and clinical settings as well?
Right. Well, definitely in the assessment, right? So we've heard, of course, when we were trained, you do a quick nutrition assessment. The problem is the assessment's done and then nothing happens with the assessment. So, unless the patient is showing very clear signs on admission, and I used to suggest, I'm an emergency medicine physician by training. And so I used to suggest that in the emergency department, when a patient was being admitted, that's when we needed to start asking questions around nutrition, so that we set them up for a good hospital relationship with food to get them going. So giving information to patients when they're in the hospital, really talking with them about their diets. I know some RDs that we're really excited about working with are talking about, like, they on telemedicine now, they say, take me to your refrigerator, and they actually go over to the refrigerator, have the patient open the refrigerator, and they talk about what's in the refrigerator. So becoming a lot more intimate with our patients around this is important. So that's outpatient. And then when they're inpatient, we need to be thinking of, what are opportunities for, say, plant-based nutrition. One of the reasons I joined Cape Farms was because I decided that toward the end of my career, I should be focusing on what I think is most important, which is nutrition. And so with that, we have plant-based supplements that are in hospital and of course are available for out of hospital as well. But it is a opportunity for people to just get started. And Teresa talked about this, just get started. We're not asking people to change their diet drastically all at once. We know that, we can start decreasing the meat, especially the red meat, and then we can go moving along sort of the train, if you will. So as clinicians, again, doing the assessment, making sure we discuss with the patients what that assessment shows, and discuss with their doctors, so as they're being treated in hospital, we can start to address a malnutrition situation. So I think those are the biggest things. Interestingly, with telemedicine, one of the big telemedicine doctors on, I think it's American Well, Mia Finkelstein said to me the other day, she said, when she, just talking to patients, and no matter what they called in for, she may get a sense that there may be a malnutrition issue, or if they're, very, very obese or something like that, she may sort of breach into that, even though it didn't come up in the, what the patient was complaining about. Let's just address it and not be embarrassed about that. There are studies, unfortunately, that show if the doctor is heavier than the patient, they actually won't bring up diet or nutrition. So very, very interesting study on that. So we have to just be much more open with our patients in talking about diet. Make sure we introduce the necessary implements when they're in the clinic and when they're in the hospital.
So for me, I'm trained as a dietitian as well. That's what my degree is in, and I did my dietetic internship in the hospital. And one thing that really I noticed was how we eat and what we feel like we can eat when we're well is so different than when we're not feeling well.
Yes.
What are some examples of ways that we can help patients who are ill or about to undergo a procedure be more ready and navigate that time?
Yes. Well, this is such a good point, and I was thinking about this when I was thinking about talking to you today, that any of us knows, just personally, when we're not feeling well, we don't necessarily, taste is not the same, our sensory things are changed, we're focused on our illness, maybe on pain, and it's very difficult to then focus on nutrition at the same time. So, for me, it's just making sure that we provide opportunities for nutrition. And, I don't want to be a commercial for Cape Farms, but I would say that, there's an opportunity there. We have in hospital now availability for supplements that are oral liquid supplements. And it just gives people an idea. It tastes great also. So it's, a tasty element. And then it's something that includes all the phytonutrients, vitamins, protein they need in the day. And yet it's plant-based. So again, and not with the confusion of like, oh, am I getting everything that I need through some of the other more synthetic supplements that we sometimes see in the hospital on the medical trays. I won't name names, but, but this is the kind of thing that I look at and I think, oh my goodness, there's such an opportunity for us to start driving that plant-based sort of discussion while in hospital, and just getting people to think about it. If you have a drink that you can take that's like, around $4 if you're getting it through e-commerce or something, and you say, oh, it's too expensive, or I don't have insurance. But if you're going to go to McDonald's, you're going to spend that or maybe more, right? And you'll get a much more nutritious meal. And then the things that Teresa said, you know, just trying to keep vegetables, legumes, you can have canned products in the home. Plant-based products very often are available in, you know, and are shelf stable. An important thing that was important during COVID, right? When people were kind of hoarding and going to the stores and grabbing things, I noticed, you know, the plant-based options were left over very often. So I had plenty to get because I'm a leaning vegan. I'm a little bit pescatarian, but, you know, but there were times when I'd go to the store, I'd say, well, everything that I need is still available. So, you know, just reminding people, easy to cook the vegetables, easy to eat the vegetables, so many things that you can do quickly. It's not like this incredible, you know, rabbit hole that you have to go down.
Thank you. That's a great answer. So kind of my next question for you, you alluded to it a little bit in your answer, but as we start to focus on better nutrition and more plant-based nutrition, how can that have an economic benefit to the healthcare system and to patients directly?
Yeah. Well, you know, there's an estimated $51.3 million of disease-associated malnutrition in the United States, adults alone. Hospital stays are generally 2 times longer when someone comes in and is malnourished. So payers and providers need to all be focused on this. This is an opportunity for everyone to decrease cost of care. You know, when you look at cost of care and you look at all the elements and things we're trying to include, to me, it's a pie. And sometimes, you know, you think that pie of money can't get much bigger, but it's really about reallocation within that, right? So we need to be focusing more on nutrition. Again, you know, where Teresa was beating that drum as well. This is the focus. Food is as medicine. Let's be more well. We know, and you talked a little bit in your last question, I didn't answer this part, Micheline, was, you know, what can we do when someone's coming in for elective surgery? So, you know, great example. We have a lot of elders going in for, let's say, a knee replacement, right? So recently there was a study about exercise prior to knee replacement. And if they got people into better condition before the knee replacements, they did so much better afterwards. So that, you know, it's kind of a no-brainer when you think about it. I would just say, let's include nutrition with exercise. And so I would say, you know, 8 to 12 weeks before an elective surgery, you know, and generally that's how long you have to plan out. That should be part of a regimen to get you into more of a plant-based eating regimen. Make sure that you've got a good supplementation if you're not eating properly. Teresa suggested always with the supervision of your physician. And then, you know, working through that with patients. So 8 to 12 weeks before, and then also after the surgery, so that they're boosted up. You know, we know that a plant-based diet can really inform the immune system and support our immune system as well. So healing is better, immune system is supported, and overall mind-body health. So, you know, you can't get much better than that. So we have to start really thinking about this beyond just, oh, I'm having my surgery. So, you know, all of a sudden a week before, people are trying to kind of pull it together. Much more needs to be done before that so that we don't have malnourished people going into the OR.
And, you know, Dr. Ambres, I've seen some really interesting research that came from Humana that a food secure person has much lower healthcare costs than someone who's food insecure, you know, controlling for all other factors. There's a $2,000 difference almost. Absolutely. Just on that one factor. And then when you add diabetes, that's another $2,000 to $3,000 in healthcare expenses for having that condition. And with heart disease, it's almost—
and you're talking per person per year, and that's a minimum. Yes, I've seen that.
And so, you know, we always think about it in terms of having or not having a disease, but it's also just the ongoing cost of managing that disease. There's just some very interesting research that's come out in the past 5 to 10 years on, you know, the cost of not eating well. It's quite interesting. My next question for you is, let's talk about, and I guess I've alluded to this in an indirect way, improving the quality of life. Maybe some examples how helping patients face those nutrition needs can improve their quality of life.
Well, you know, I can kind of give some personal examples even there. I look at my own nutrition journey. You know, I think I was eating candy bars through most of college. I recall that.
Yeah.
That was, you know, I came from a good home in nutrition. My parents grew up in the South, which, you know, sometimes is not associated with the best healthy food. my mother, for whatever reason, decided to kind of go off of the plan and start to do very nutritious meals, especially sort of leaning with a heavier amount on the plate, you know, similar to the plate that we showed earlier with legumes and with vegetables. And then when I went to college, you know, that was all gone away. You know, so it was like basically hamburgers and, you know, that kind of stuff. And I was sick all the time in college because I just couldn't properly digest the food. I just was like, oh my goodness, the first time I got indigestion, I thought I was like near death or something. I called my mother. She was like, I think you have gas, relax. So I never had that before. So yeah, so we, you know, we have a tremendous opportunity there, just getting people to think differently about diet and try to move the bar along. When I was at, you know, so let's go back to my own mother. So my mother, in her last few years of her life, she wasn't eating well, and she had late stage colon cancer. She was in, you know, 88, 89 years old, and we had decided that surgery was not going to be an option or anything like that. We weren't going to go in those directions. So it was really about trying to keep her in a good, reasonable state of health and a, you know, in a place where she was still having quality of life. And I think this happens with a lot of our elders as we see that we're aging and staying alive longer. So for me, it took me a while to realize that she wasn't eating her food as well as she should have been. And I started really watching when she was eating, and she was doing this thing that we call, or the geriatrician informed me that we call juicing, where she would chew the food and like literally take it out of her mouth and sit it on the side of the plate. So it was a very interesting time to watch this. I realized she was also losing real weight, as they say, which means muscle weight. And I said, okay, I've got to do something. And actually, that was my introduction to Kate Farms way before I worked for Kate Farms. I had heard about it, found out about it, and I wound up introducing it to my mother. And it was a great opportunity for us to have another kind of connection, because one other thing that happens when people stop eating is that they lose the social connection of eating. And so she and I would have our nutrition shakes together, and we would listen to a podcast, or I would tell a story, and it was an opportunity again for us to almost have a meal together. But coincidentally to that, her cognitive abilities were much improved. Her hair and nails grew. I just saw a transformation, and it was transformational for both of us, for both her and for me as the daughter, and of course as a clinician. Really opened my eyes. I introduced it to her geriatrician. He started about 100 patients on it, and he was saying it's just like amazing to see what that plant-based introduction and real nutrition could do. And it was easy, of course, so ease of use becomes a very important thing. So I do, you know, recommend for people, whether it be, you know, our companies or any, to try ease of use, you know, so these nutrition shakes that are healthier, that are plant-based, I think are a good example for something that you can do. And, you know, it's not hard for patients to do it. Other people have, you know, told me all sorts of stories along the way. And I know that there are centers now in different parts of the country. One I'm thinking of is Think Whole Health. Think Whole Person, actually, it was Think Whole Person, which I love the name of that. It's in Arkansas. And Think Whole Person is mainly focused on outpatient, and they do a lot of focus on nutrition and also polypharmacy to see, you know, that patients are looked at in terms of what they're doing with their medications. We also know that's an issue, right? Patients just continue to get medications added on as they get older, and nobody looks at the, you know, whole person once again. So I just love the name of that institution, Think Whole Person. I think it's the best. So they're doing great work there as well. So there are places, you know, all across the country that are trying, but it seems like it's almost in an experiment phase versus this is how we're going to do it. This is how we're going to do business as healthcare providers.
Well, thank you so much for sharing that very personal story about your family. And, you know, as smart as everyone is and experienced experts that we have, sometimes it really is that story of the one and your own family member and finding something that works so, you know, so well like that. So I appreciate you sharing something like that.
And we have, just quickly, I'll just say, we have, like, you know, examples also of kids that, you know, we're focused in pediatric enteral nutrition. And so we have an example of a child that was being airlifted to UCLA multiple times in 6 months of their life because they weren't close enough to home. The child was so malnourished and so ill, they had to be airlifted to UCLA. This happened like almost 5 times in a 6-month period. And it was due to intolerance with their formulas. So, you know, you look at something like that, forget the cost of care, of course, is there, but the cost to that family, loss of productivity in work, obviously tremendous emotional stress on parents and child. And then it was turned around just by putting that child on a proper formula. And within that time where the proper formula for that child was found, we were able to see a complete, in the next 6 months, there were no visits to hospital. So I think, again, it's really up to all of us to work together to make these kinds of changes.
Thank you so much. My last question is going to be for both of you, and then we're going to go to some of the chat questions that we've received. So Teresa, we'll start with you, and then Dr. Ambres as well. Can you answer the question about some additional resources for both clinicians and consumers to learn more about plant-based nutrition?
Right, so I think number one would be the lifestylemedicine.org, as I mentioned. There's also a lot on the Harvard website. So the 6-week plan that you mentioned and the plate that I showed, there's lots of resources on both of those websites. And then of course, lifestyle-based registered dietitian would definitely be a great resource, and those can be found through Lifestyle Medicine website as well. And then of course on our campus, we have myself and another registered dietitian that we'd be happy to answer any questions, and just contact us through UNTHSC or through the people hosting this webinar.
Thank you. Dr. Ambres?
Great. Well, definitely, you know, Teresa mentioned Lifestyle Medicine, ACLM. I would add nutritioncare.org /malnutrition. That's Aspen, the American Society for Pediatric Enteral Nutrition. So nutritioncare.org /malnutrition, and also nutritionfacts.org, which is Dr. Michael Greger's site, wonderful site, has really specific information, so you can put into search and get the information that you want. And then another one that I found recently, I thought it was a fascinating thing, is Ocean and Tim Robbins. So they're from Baskin Robbins, and very interesting family story, very briefly. The father, Tim Robbins, wound up leaving the Baskin Robbins franchise because he realized that maybe that wasn't the healthiest thing. He describes that sometimes they would even have ice cream for dinner. So he said, you know, he had a lot of illnesses as he was growing up and realized, gee, I need to be doing something different from this. And so he started a foundation. So they have great information, recipes, also plans that people can join. So another wonderful one. Books, Forks Over Knives. We've all heard about that one. And then One Meal a Day, Susie Cameron wrote as James Cameron's wife. She's been a proponent of plant-based diets for some time, and she recently released a book. One Meal a Day also has a recipe book as well. And then if people don't want to read and they want to see a short documentary, Game Changers. And that's a great one for athletes to see in particular, or people who feel like, oh, you can't get enough protein. Again, Teresa mentioned this earlier, you can't get enough protein through a plant-based diet. Not true. And James Cameron and Arnold Schwarzenegger did that, Game Changers, which is just phenomenal.
Fantastic. Thank you so much. All right, a couple of chat questions and comments from the chat. The first one is a comment for Cynthia. I think sugar and simple carbs are setting up cravings for more sugar, and the vicious cycle starts ending up in unsatisfied hunger. Cynthia, Teresa, what do you think about that comment?
Well, sure.
Yeah.
Go ahead, Teresa.
I would definitely agree with that. Again, it goes back to where I said, you know, people that want to eat healthy immediately start cutting out carbs, and we need those complex carbs like we talked about. Not all carbs are created equal. So if you're not eating enough fruits, vegetables, and whole grains to meet that minimum amount, especially if you're active. So for athletes who are also following a lifestyle medicine or very strict plant-based diet, you're going to need those carbs to replenish what you use in exercise. But you also need carbs if you're a low exerciser. They're just needed for brain glucose, for sugar that gets into your brain to help your brain work. So yes, when you don't have those carbs available, then you are going to crave simple sugars. So then when you eat those simple sugars, your blood sugar spikes, then it drops immediately because you're going to secrete insulin in response. And then you're going to have this up and down and never feel good. It's a vicious cycle.
Yeah, there's just a tendency, we have taste sensations that we enjoy, many of us, so sweet and salty. Both of them can be detrimental to us. So just as Teresa described, it's complex carbohydrates. All carbohydrates are not created equal. So you want to look for the carbohydrates that are a little bit better for you. And also, it's about bringing together carbohydrates with other parts of the meal plan so that it is well utilized by the body. So I think it's all of that, but we do have to I love sweets. I love sweets. And so becoming, as I said, becoming vegan has pulled me out of sort of the dairy part of the sweets and that kind of thing, but it's a struggle. I do maintain it though every day.
Well, I find that when I do have that craving for sweets, like for example, I ate lunch right before we came on to this, and so I had, a little bit of yogurt and fruit and then nuts and with a little bit of salt, on those nuts. And so then I had my fat, my protein, and my carbohydrate all together. And that's really what, when I would counsel athletes and really any person that's, trying to mind their diet, or anyone for that matter, but always have all three constituents, fat, carb, and protein, at every meal and every snack, because that's going to balance that blood sugar rise so that you don't crave those simple carbohydrates later. And it will carry you through to your next planned meal or snack, so you're not just continuously snacking or feeling unsatisfied. There's that satiation that you get from having the adequate amount of, the right amount of carbs, protein, and fat together.
Yes.
So our next question, excuse me. Our next question is for Dr. Ambres. What are your recommendations when patients express the desire to practice intermittent fasting?
Well, intermittent fasting is an interesting thing, and I think that I personally lean more toward the sort of idea of the daily fast. In other words, you stop eating earlier in the day and then try to get at least 12 hours. I know there's a lot of recommendation in some of the new literature to 16, but that's hard for people working. It's maybe a little easier right now during COVID if we're at home and we choose to try to introduce a new dietary plan. But, doing that kind of fasting, I am not as big on for most people. And again, this has to be planned. If you're going to do long-term fasting of any type, I think you have to do that in consort with with a dietitian or with your physician or both, because we all have different just our basis is different, and so we have to make sure that where we're starting from, that is a good message for the body, so we just have to be very careful. So I would say that if you're thinking about doing kind of what I call the local, the 12 to 16 hours away from food each day, I think that can be very helpful for a number, and we're starting to see that released in many studies for a number of chronic conditions and either preventing or reversing them.
Thank you. Dr. Wagner, do you have any tips for making a smooth transition into plant-based diets? How do we make it easy for people to get started?
Yeah, exactly. Well, there was the Harvard 6-week plan, but if you're just going to try to wing it, I think it's just really gradually moving towards, adding more vegetables and fruits to your diet and taking out some of the amounts of meat. So for example, we talked about that most of us get too much protein. Well, part of that is because we tend to think of a serving of meat to be 6 to 8 ounces when it really should be about half that size. So just reducing the amount of meat that you eat is going to increase your appetite, right? Because you're not getting that satiation from the extra meat. So then fill that rest of your appetite with vegetables, grains, plant-based foods that are going to help fill you up and give you more nutrition at the same time. So that would be one. Two, I would say plan ahead, because I think that's probably most people's downfall is we wait until we are starving or hangry to really think about what's coming next onto our plate and where we're going to be able to get our next meal, which has become even more challenging in today's environment. And then, you know, thinking about, I had put on the one slide about recipe substitution. So if you're making pasta, think about, you know, putting vegetables in and decreasing the amount of meat or substituting vegetables. It just depends on how fast you want to transition. But yeah, to make it easier, make it a slow transition if you feel like you're going to struggle at the beginning. And then, you know, as far as the proteins, adding in some of those nuts and beans and legumes to help really give you that more hearty feeling of fullness if you're needing that to feel satiated.
And some people are, you know, you talk about that, Teresa, it's really great, the, you know, the substitutions, and some people are using the plant-based meats, you know, so this meat substitutes, just to give the sort of texture and potential flavor that they're used to a bit. And again, that can help as a transition. I know people don't necessarily want to focus on processed foods, but we can say that that's a bridge.
Yeah, definitely. But again, minding portion sizes.
Yeah,
right?
yeah, absolutely.
I'll throw in one more tip for everybody too. We actually have a series of classes called Kitchen Garden Cooking School, and we focus on a different plant every month and offer 3 recipes and 3 ways to make it. One of my favorite new ones is on mushrooms, and we have a taco that is basically mushrooms and walnuts as the filling, and it is just fantastic. And you get that same heartiness and that umami flavor coming through that you would expect with something like ground beef, you know, if you're used to something like that. So we've got one more question here. This one's for Cynthia. When drinking plant-based shakes, how often do you recommend drinking them? Are you only using them as a supplement or for meal replacement?
Sure. Well, again, I can speak the most about our own in Cape Farm. So our shake is a full meal replacement. It can be used, however, as a supplement if someone wants to do, you know, if it's snacking is an issue for people, I sometimes recommend that they, you know, open a shake. It's the good thing about it also, it's shelf stable, but once you open it, it should be refrigerated, right? So you can drink part of it, you know, so if you have 325 milliliters and there's 325 calories in that, that can be, obviously can be a meal for some, and it may be a half of that could be a snack for some. So, but we do have, of course, because of certain medical conditions, because we are a medical nutrition company, we have a lot of people sole source on plant-based oral nutrition. So if it comes to that, that's possible, but of course we want to maintain, you know, and we think about cancer patients and oropharyngeal cancers, that kind of thing. When they go on these kinds of supplements, we like to maintain some chewing and some other types of eating that maintains our ability to sense in that way for the throat and so forth. So there's all kinds of ways of looking at it, but for those people who can only do oral, there is a range for that as well. And again, for weight loss, that might be a wonderful opportunity.
So we are right at time, and I want to thank you both so much for taking the time to be here today and share with our community what plant-based nutrition can do when you're healthy and when you're not so healthy, and when you're looking to, you know, make a few changes and create a healthy lifestyle for yourself. So thank you both very much.
Thanks,
Thank
Micheline.
you so much, Micheline. Great to see you, Teresa.
You too. Bye.
Bye, everyone.
Bye.
Stay well.